Well, greetings again. It's Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to show how we're using this method of bringing in impacted teeth on adults or anybody as far as that's concerned. And you can do it on people as long as they're living anywhere. And so it works. And if you think it's too complicated for you, just think through it. It's not all that complicated. And it provides a direct force of the deal, how much force you're going to put on exactly, and it'll bring teeth in where you hook up on the tooth, what kind of hook you use, and what you use to bring it down to position in there. I've got just oodles of impacted cases, so go in there and study those cases, and you can learn to work with impacted teeth. And if you will just sit down and think about what you're doing, you can figure out how we do this impacted tools to bring that in. Now I'm going to show a case here where we actually do this. This is that's a bad picture, but this man has the hardest bone I think I ever ran into in there. Now we're more in focus, and this was back when we had to take all the pictures with a camera and send them off and get them developed, everything. He had an impacted tooth up in here where this upper left lateral was, right in this area. I don't know why. It's up here where it is. And that's a baby tooth there. So we took that baby tooth out, we put a spring in it to open this up wide enough, and we're talking about this cuspid over here that's impacted. And this was out of focus again. Now here is the deal. We pulled so hard with springs, this must have had at least 1.5 pounds of force on that tooth. And I don't know why it took so much to get it out there. I had to put a big daddy arch wire in here to support it. But anyway, here's our springs, pulling it in this direction. And went in there with a hook tied onto that tooth and pulled that tooth into that position. And here we put a big wire in there to keep it. In other words, we pit all the teeth on the other side of the mouth, on the hip, and so to keep from pulling the whole arch in that direction. Now this is the tooth coming through, and we had 2 springs on here, pulling it, bringing it through there. We had we tied all these teeth together. We brought it in, lined it up, rotated it, and here's a little wedge we use in rotation, and it rotates the teeth like that. Now this, we pushed everything over, so pulling this tooth through that space actually moved the whole arch a little bit to the left. So we had to use some elastics coming on here to keep these teeth in the proper relation. And there that impacted tooth is, right here. We just brought it in. Now we gave it a little extra room. When we get it in, we close that space, tying your arch wire back. There it came up, and here we have to change and rotate that tooth as we come through there. We got it in, and you can wrap that chain around it and put a water acrylic down here to hold that elastic on there, and you can spin those teeth any way you want. Go study the deal on rotation of teeth. Got the best method I've ever seen to do it, and this is the best method of bringing in impacted teeth that I've ever seen. So it just works good, and we figured that out. As you pull that tooth in and leave a track back here, we got it in there and torqued it correctly. Here the big cuspid is. Sit right up in that area. I'm going to erase that. We have to pull that over and then pull it down there. And he didn't have the wisdom teeth when he started. But he doesn't have any wisdom teeth, period. And we went in, hooked onto this tooth right here, pulled it in that direction. It moved the tooth over, and it kind of crooked the root of it here. We got some root resorption. Put so much force on it, we got some root resorption in there, but not much. I've never lost a tooth from root resorption. So we got it in there, age 48 and 3. And we finished it up. We put a little deal on the lower anterior teeth right here. We checked the TMJ, see if it was doing all right, and it was. It's at age 41.7, and we got the tooth in. There's the condyles up in there. Now this is, we had a crossbite here. These teeth were in good shape. There we got rid of that crossbite. That's on the right side. Over here, we're to take that baby tooth out. We opened that space and brought that tooth in. You see where that is now? And here's that cuspid. We brought it through into that space. We got it up in there and rotated it with a rotating method we used. Put a 3-to-3 on the bottom to maintain that. Put them in some type of retainer, and that's the end of that. So thank you for watching. If you're interested in impacted teeth, I've got a whole string of impacted teeth. You can go through it, and you can see lots of different ways. And one of them, we luxated the teeth. They had to break them loose to get them through and to get them to move. And so we use that. So thanks for watching, and I'll close out again.